name is Adrian Aguilera, and I'm in the School of Social Welfare. My research interests are in studying the development and testing of mobile health interventions for mental health problems. So just generally utilizing technology to improve our health. And my focus in particular is on low-income populations, Spanish speakers, people who tend to not be included as much in the development of these innovative technologies or interventions. So most of my work has been using text messaging as a way to deliver information about health and mental health. The first project that I did in this area was using an automated text messaging system to help people track and manage their mental health while they're in treatment for depression. So people were in a 16-week treatment for depression, and during that, they're responding to messages about their mood every day, as well as practicing skills that we're teaching in class in session. And we found that when we do that, people stay in treatment a lot longer, 12 weeks until dropout compared to 3 weeks for people who don't get the text messages. So we're able to keep people engaged a lot more, which is a challenge for mental health treatments, particularly in the public sector settings that I work in. We're also doing a project, we're doing two active projects. One is using text messaging to motivate people with diabetes and depression to walk more. Again, with a focus on low-income patients and a large group of Spanish speakers. And we're using some machine learning algorithms to personalize the messages that people get so that we can tap into motivations that vary. And then lastly, we have a current project called Stay Well at Home, or Bienestar en Casa, where we've developed a texting program to help people deal with the stress and anxiety of social distancing and COVID-19. And so this is a project where we're kind of just recruiting broadly and allowing people to use it broadly in the community to hopefully help manage some of the challenges going on now. And the initial results we've seen, there's some improvement in some reduction in kind of symptoms of depression, some kind of stress and anxiety. And so that's an ongoing project as well. Currently, I mainly teach a cognitive behavioral therapy class in the School of Social Welfare. And this is typically focused on training MSW students, Masters in Social Work students, on the techniques of cognitive behavioral therapy. You know, the students who tend to, I think, do the best are the ones who are willing to reach out and, you know, ask for mentorship. And, you know, I also understand that faculty in particular can be very busy, and sometimes you don't get a response, right? If you really want to work with somebody, try again. It's okay. The worst thing that can happen is you don't get a response or they say no. But I think we also respond to persistence. And then sometimes, you know, it may be best to work with a graduate student, for example, or somebody just above you in kind of in career stage. And they can kind of guide you in terms of what's coming ahead. I think students are very much kind of in touch with the world and kind of the needs of the world. Extremely bright students, very motivated. So that's always kind of the driving force, and I think what keeps us going. And then along with that, I think my colleagues, who I always, you know, enjoy talking to, collaborating with, and particularly, I think all of us are at Berkeley because we believe in the public mission of the university and trying to have the resources and knowledge be applied as broadly as possible for the public good.